God had told him not to eat, and that until God told him to eat, he was not going to eat.
You wouldn't treat an animal the way he was treated. He suffered.
He was worried for himself, very worried. Whether it was going to be somebody else hurting him, it would be that or himself.
You're not supposed to be finding psychotic individuals who are not on any type of, mental health medication locked in solitary confinement.
Armor Correctional Health Services is a Miami company paid $25 million a year in taxpayer money to provide health care in Broward County jails. A Sentinel investigation found Armor has failed to protect some inmates endangered by their mental illnesses with deadly consequences. One of those inmates was William Herring, a 23-year-old from Deerfield Beach. He had bipolar disorder and schizophrenia. Herring told his caretakers in the jail that God would tell him when he could eat. Then he starved himself to death before their eyes.
I thought that they would be able to somehow force him, even if it meant putting him in the hospital and force feeding him.
Herring refused to take his mental health medicine, eat, or drink. Jail medical staff sent him to a psychiatric clinic and a hospital where he was given mental health medication over his objection. But no such efforts were made when he returned to the jail. A Sentinel investigation of inmate deaths since 2010 found that Armor has left severely mentally ill inmates unmedicated and malnourished, despite having the authority to help them. Lack of medication can worsen mental health symptoms, leading mentally ill people to not eat and harm themselves.
They've made a promise with the sheriff and the people of Broward County to accept $25 million a year to provide comprehensive health care. That means if you have an individual who's not eating because the good Lord has told him not to eat, you're not allowed to just stand by and let him die.
The Broward Sheriff's Office said it had no complaints about Armor's care of inmates in the jail. Armor medical staff declined to be interviewed, but did issue a statement saying, quote, "Our professionals are regularly tasked with the unappreciated job of caring for those that the community and their families have abandoned. Those professionals do this job every day to a standard beyond what can be found in the public health system." End quote. Like Herring, Fort Lauderdale native Raleigh Priester suffered dramatic weight loss in jail before he collapsed in his cell and died. Priester, who had schizophrenia, shed some 30 pounds in the last month and a half of his life. Though a jail doctor thought Priester's lack of mental health medication could make him suffer, he gave him none in the jail. The medical examiner cited heart disease as his primary cause of death.
He was big, like I'm big, but when we seen him, he was just skin and bones, a skeleton. We couldn't believe that he was in that state. Only way we really verified him because of his eyes.
Investigations by Armor and the Sheriff's Office found no problem with Priester's care, but records obtained by the Sun-Sentinel raised questions about how closely he was monitored.
According to the records that are kept by the Broward Sheriff's Office, they looked in on Raleigh Priester and that he was alive, well, not having a problem, over a period of 18 hours after he was dead and his body was removed from the jail.
The Sheriff's Office blamed the erroneous records on a paperwork snafu. Despite long-standing concerns about the impact of isolation on mentally ill inmates, the Sun-Sentinel found 4 who hung themselves while they were housed alone in cells. One of them was Kenneth Kellum of Hollywood, who was booked into jail in June 2010. He told an Armor health worker that he had bipolar disorder and anxiety. That worker admitted in a deposition that if she had noticed the red mark across the front of Kellum's neck, she would have put him on suicide watch. Instead, he was sent to a solitary confinement cell. 27 hours later, the 21-year-old was found hanging by his bedsheet. Armor records show that staff acknowledged mishandling the care of at least 4 mentally ill inmates before their deaths. This was the case with Stephen Shogan, who had schizophrenia. A confidential Armor report said medical staff failed to give Shogan his medication for the 12 days before he hung himself in January 2013.
It's like depriving someone their insulin and suffering to death from that, but it's just in the mental capacity, and that's something I can't fathom, and I think it's pretty scary.
With incomplete information about how their loved ones died, family members are left with uncertainty.
I just hope another family don't have to experience what we had to go through. Everybody is important to somebody, whether they're homeless or not. They're special to someone.